Welcome to the Digital Think-In series. This is the third of a series of 6 events we are running until November, really in substitution for our very large annual conference we run each year. As with the conference, we're very grateful to our sponsors, Unifar, whose support is crucial in helping us to run the Digital Think-In series and indeed for the conference. And thank you again to them for their continuing support over the years. In this event this morning, we are partnering with the Irish Pharmacy Union, again, one of our key partners and stakeholders for all our work, and with the polling firm Behaviours and Attitudes to explore the impact of COVID-19 on our health, including our mental health and on our daily behaviours. Shortly, we will hear the results of a survey conducted for ourselves and the IPU by Behaviours and Attitudes. I'm not going to go into the details of it, except to say the findings are very interesting and probably not too surprising. We know that people are experiencing feelings of mental fatigue and anxiety the longer this goes on. People are worried about their jobs and financial security, and this is borne out in the survey. But there are positive sides too. I believe we are exercising more, we're sleeping better. Would you believe it? We are closer to our families and friends. And these are elements we'll see in the survey findings. People too are turning to their community pharmacy for solid healthcare advice, which has been a key part of the IPU's mission and indeed the support of the Consumer Healthcare Division of IFA for that orientation, that people should talk to their pharmacy, ask their pharmacist for advice and so on. So first we're going to hear from Larry Ryan, partner at Behaviours and Attitudes, who will tell us what the survey says. And then we'll have a panel discussion with Dara O'Loughlin, Secretary General of the IPU, Gráinne O'Leary, CEO of Arthritis Ireland, is here with us also, and Nicole Foster, Head of Supervision at 50808, which is part of spunout.ie, the online information portal for young people. Our moderator of the discussion this morning is John Sheehy, who chairs the RRIPHA's Consumer Healthcare Division. John is also the country manager for Perrigo Pharmaceutical Company. So do please use the chat function on the platform to ask questions of our contributors. We do want to make this session engaging for everyone as possible, despite the difficulty, as we're all familiar with now, of not being physically present together. So I'm going to hand over to Larry now in a minute. Larry, indeed, has been exercising more. He was telling us just before we came online that he's done his run this morning, which is a fantastic thing. Well done, Larry, and thank you for bringing this information to us this morning.
Good morning. Thanks, Oliver. How are you? Pleasure to be here, and hello everybody out there in IFA and the IPU. So I'm going to talk to you for about 20 minutes, maybe 25 minutes, to give you feedback from a survey that we ran in the early to mid-September, and it's looking at I suppose our perspectives of self-help and self-care and how that's been changed by the experience of COVID. We initially did a survey for last year's IFA conference, again with the support of the IPU and IFA. And I think my battery's running low on this, Megan. But so this is a reprise on that and asking people about healthcare decision making in the context of COVID and the restrictions it has brought about. So quite an interesting study. We talked to 1,000 people. The survey was online, as all of our research has been since March, though we've been more recently going back to doing some face-to-face work again. But a sample of 1,000, so it's an error margin of about 3 percentage points. So just important, I suppose, to bear the context in mind. We are, I suppose, 6 to 7 months into lockdown. We're looking at an environment that's hugely changed. Levels of unemployment have shot up. GDP has declined, though we see today the central bank quarterly report saying things aren't quite as bad as we had thought. And in September, we were looking, I suppose, at the prospect of new lockdowns potentially as kids started to go back to school and so on. So great uncertainty for people facing into this period. And obviously a lot of concern that the decision making that has been made about COVID has been very tunnel visioned. It has only taken the health parameter into account and maybe has ignored the economic realities, and a lot of concern for that. And clearly, people worried about their employment and and many other things, paying mortgage and so on. And as we saw, the rate of COVID had started to creep up again. So the only, I suppose, slightly encouraging thing is that this isn't local, it's global, and it's not just happening to us, it's happening all around the world. Though, as we can see, the rate of improvement in the economy is slower in Ireland than in many other markets. So we're going to move through into the main body of the survey. And there are three key themes I want to talk you through. Firstly, with a changing relationship with healthcare professionals, particularly doctors and pharmacists. Secondly, the impact of COVID on our physical and mental health, what it's done to people, both physically and, more important, as it turns out, psychologically. And thirdly, how it has impacted how we make health-related decisions. So I'm going to start off with the relationship with healthcare professionals. And as we'll see, quite a big shift there. So first part I'm going to talk you through is to do with, I suppose, just to give you an illustration of when we're talking about health, normally we're talking about older people. So predominantly, when we look here at how dependent people are on medicines, we see that mainly we're talking about older adults being dependent. So about 40% of us take medication all the time. Another 3% take periodic medication and so on. You have 10% of the population say they never take any medication. I used to work an awful lot in the alcohol sector, and it's very similar to the proportion of people who drink, the proportion of people who take medication, except in relation to alcohol use, it's much higher younger, with pharmacy and with medications much higher older. So we go from about 1 in 8 under 25 taking medication regularly to 3 out of 4 when we get to the over 65 age group. So largely, when we talk about healthcare, we're talking about its implications for older people. So when we get to COVID, things look quite different. So the pandemic saw a huge change in people's likelihood of visiting the general practitioner. So about 1 in 4 are visiting the doctor less often, and about 1 in 5 were too afraid to visit the GP at all. You can see at the bottom, about 30% of the population say it didn't make any difference to me. I generally don't go to the doctor. So largely they're younger people. They feel well. They have no particular medical issues. But we can see that about 950,000 people, nearly 1 million people, say that they're going to the doctor less often, and largely they're in what we would call the family life stages. They're a bit more likely to be female than male, and of some of the people who cut out visiting the doctor entirely, they tend to be in the under 25 and the 25 to 34 age group. And consistently in this study and in studies that we were involved in right across the world, we did a study in March and another one in April on the initial impact of lockdown. We saw younger people more afraid to go to the doctor than older people. And this kind of surprised us. We thought, okay, that's counterintuitive. Doesn't really make sense. Why would a younger person be more alarmed than an older person? But it's been borne out in successive studies. So the group most uneasy about going to the GP tending younger. So moving through, we asked about people's usage of a wide range of different healthcare professionals, and the most striking thing is a huge increase in people's use of the pharmacy. So we've about 70%, 69% of people now visiting the pharmacy monthly. And when we asked the same question this time a year ago, it was about 32, 33% of people visiting monthly. So we've a doubling effectively in the number of people visiting the pharmacy monthly. So a huge increase in footfall into the pharmacy. And at the same period, a slight reduction in numbers saying that they've been to the GP in the past month or in the past quarter. There's about a third of people who say they've been in the GP at the GPs within the past quarter. But the really remarkable shift is in relation to the pharmacy, and there's also a growth in people looking up their medical symptoms online, but it's not that huge or pronounced a growth. And as we'll see consistently through the study, people generally needing, I suppose, outside input into decisions that they're making at present, rather than relying solely on their own resources. So if we could move through to the next slide, please. And as we can see, the increase in pharmacy use has been across the board and across all age groups. It's not just younger or older. It's happened in both age groups. So and still slightly more skewed female than male. Women a little bit more likely to visit the pharmacy than men. In Germany, the profile of the visitor into the pharmacy is about 2 to 1 female to male. But everybody became more likely to use the pharmacists during the lockdown period. And again, it increased across all regions as well. So ultimately, at the end of the survey, we had asked, in light of your kind of lockdown experience and the restrictions it brought about, who has become more important to you in the context of healthcare decision making? And about 30% of people said the pharmacist, 31% the GP, and the hospital consultant at 9%. And normally, when we ask people who their key healthcare professional is, we get a disproportionate weighting in favour of the GP. The GP tends to be much more important to people than the pharmacist, but in this instance, the pharmacist has substantially pulled up. So a recognition that people recognise the importance of the pharmacist in this context. So in light of people's inability to go to the GP, what did they do? So about a fifth of the population say they attended a virtual clinic of some sort, or numbers of them. And this is really striking in that maybe 2 to 3% of the population were ever availing of this kind of virtual alternative before. But obviously it's jumped massively in the past couple of months. And it's not necessarily just people going to their GP this way, or indeed interacting with the pharmacist this way. It could be interacting with their health insurer or whatever else. And then about 1 in 5 again say that they consulted with their pharmacist. And this is a little bit more likely for people in more advanced life stages, whereas the younger age group's a little bit more likely to have availed of virtual alternatives. And about 10% saying that they largely self-medicated or self-treated. So we can look at those options that we saw on the previous chart by the groups who say they went to the GP more in green, the ones who went to the GP about the same amount, and the ones who went to the GP less. And what we're seeing in those middle bars is a much greater proportion of people who went to the GP less or the same amount, saying that they relied or they consulted with their pharmacist more. So the shifts brought about by lockdown have pushed people more towards interaction with the GP. And how are you?
How are you?
Sorry, we had a
technical difficulty.
We had a power cut. Just waiting for the visuals to come back. I don't know if you can all hear me. And just to say that of the ones who interacted with the pharmacist, they did so for a variety of reasons, but one of the most important elements of the lockdown was the change in legislation that allowed pharmacists to extend the applicable length for prescriptions. And there was a big shift in that regard, with up to 20% of people saying that they availed of that service in the pharmacy, and about 10% they went to the pharmacy for minor ailments and so on. So I'm not sure if you can see my screen. I can't actually see it myself. So I'm hoping you can. So if we go through to the chart on the healthcare impact of the COVID-19 restrictions, you can see it great. Effectively, about 40% of the population say that COVID had a significant or at least some impact on their own personal health, and about 3 in 5 say that it had an impact of some sort. And what's interesting is greater impact is noted amongst those in younger age groups, and particularly family life stage age groups, and much more likely to be the case amongst women than amongst men. So moving through to look at the psychological impact, we asked people to think about their mental health and their balance, and which terms applied particularly to them. We've about a quarter of the population say that they generally feel very much in control of their mental health and emotions. They don't worry. And another 50% say that they go through occasional periods of worry and doubt. But we have about 17% of the population, about 1 in 6 people ordinarily, who say they worry a lot or they're in very poor control of their mental health and balance. And consistently, and we asked the same question last year, we'd have about 15 to 18%, and generally more likely female than male, saying that applies to them. However, what is really striking this year is a doubling in the numbers in the 25 to 34 age category, saying that they feel mentally shook, they're not well, and they're consistently uncertain about themselves. And that was at a level of 9% last year, and it's gone to 19% this year. So really an enormous shift there. So we asked then about what impact lockdown had on people's health, what negative things occurred. 3 out of 4 people say it had negative implications for them. A lot of people ate too much. About a quarter worried about catching COVID. But as we can see, most of the manifestations tend to be psychological: anxiety, depression, worry about loss of job, inability to go out and exercise, and so on, and quite a range of things. And it's quite far down the list. We have to go to seeing people missing hospital appointments or having treatment deferred and so on, or only just 4% saying that they felt a long-term medical condition had deteriorated. So if we run through to the next chart, if we take a number of these facets together and we look at people with diminished confidence, and then worry about money, worry about economy and so on, 44% experienced anxiety or depressive type symptoms, and a similar number, about 44%, complained about either eating too much or being unable to exercise during the lockdown treatment. And only about a quarter referenced missing treatment, 4% the deterioration of a long-term medical condition, and ultimately just 2% indicating that they had caught COVID, which is considerably in excess of the level that would be reported. But then, as we hear yesterday, the WHO is saying probably 10% of the population has experienced it in most countries at this stage. Then positively, 2 out of 3 people say that they have had positive implications of lockdown. People taking more exercise, about 29% saying they're taking more exercise, versus about 17%, as we saw a minute ago, unable to take exercise. And more than a quarter of the population trying to be more positive, trying to put a positive veneer on things. And then the ability to get more sleep, spend more time with family, and experience less work-related stress. And about 14% say there were positive ramifications of dietary on a dietary level, versus, as we saw, about 35% saying that they had eaten too much. But exercise and diet are quite significant elements. And a similar number reducing their consumption of alcohol as increased it. And the third section I wanted to talk about is in relation to the impact on healthcare decision making. So, firstly, we asked a similar series of questions last year about choices people make in relation to their health and in the ordinary run of events. And we asked the same series of questions this year, where we said, how have these choices been impacted by lockdown, and then comparing last year's data on the left-hand side with this year's data on the right-hand side. And I'll highlight where the significant changes are. So firstly, we asked about whether people liked to browse and look at different medicines in the pharmacy, or whether they tend not to browse and ask the pharmacist. And as we can see, the first implication of the COVID situation has been people have become much more reliant on the pharmacist for advice and input. They've become less confident to make healthcare decisions themselves. Secondly, we see that people have become a lot more equivocal. They're slightly more on the fence in relation to their own health than they would have been a year ago. And then we also asked about that people feel empowered to make decisions in relation to their own health, or whether they like to rely on the advice and input of guidance and experts. And we would expect, with the growing trend towards self-care, that empowerment drive would have increased. But in reality, we see that fewer people are saying that they feel empowered, and more people are saying that they need now to rely on the advice and input of experts. So people have become more hesitant, more uncertain, more self-doubting as the lockdown situation has persisted. And it kind of runs in the face of the predominant ethic towards self-care that we had seen growing in recent years. So the greatest proportion of the population feel neither expert nor naive in relation to their health. They remain relatively uncertain. And one other shift, kind of in a different direction, while the majority of people say that having time to mentally recharge and have personal time on their own is important, there's been a slight reduction in that over the lockdown period. And when we dug into the data, we see that the group who've become less certain about that are in that 25 to 34 age group that we talked about earlier. So they are the ones who, despite being under psychological pressure from lockdown, and if we think about the reasons why so many of them have been forced to maybe move back home and live with their parents, they're suddenly shut out of work for the first time maybe in their lives, and in many instances we know they're the group that have been more likely to be laid off. So they're early in their careers, and when the furlough schemes and so on happened, they often face the door before other people in employment. So they have become much less able to relax and take time on their own. So ultimately, we see that there's a reduction in people's self-confidence and a growth in the need to liaise to rely on experts for medical advice. So hopefully we've got to my kind of final takeouts page. I can't see my screen, apologies. But just to summarize and make the key points. Firstly, huge shift in our use of different healthcare professionals. We saw obviously a big reduction in people's ability to go to the doctor. People were afraid to go to the GP. About a fifth of the population too afraid to go, and another 20% going much less than they would have done before. And as a result, people have turned elsewhere for advice and guidance. So a huge increase, a doubling in the numbers. So 2/3 going on a monthly basis to the pharmacy. So obviously big increase in footfall into the pharmacy. And as we saw, often going there to avail of the ability to extend prescriptions and so on. So the pharmacist has become much more important. Notably, the impact has been really significant on 25 to 34s. And you might have seen a poll we had on RTE on Thursday night last. And again, it highlighted the significant impact of the pandemic on that age group. And I've seen 3 or 4 separate studies in the past month that all highlight the sort of profound psychological impact on what we would call millennials. And they seem to have been hit much harder by the lockdown than any other group, whereas their older counterparts who maybe are more settled, they have families, they live in a home that they own and so on, have been able to deal with this much better. But often with millennials, you find 3 or 4 of them are living in a flat together. It's really difficult to work from home if they manage to keep their job. And they have struggled with this. So, and ultimately, in terms of healthcare ramifications of the pandemic, they're much more significant on the psychological scale than they are on the physical health scale. So we did see some deterioration in pre-existing healthcare conditions, but predominantly on nearly half of the population feeling that they have had experienced a significant psychological impact, and just 4% saying that they've experienced the deterioration of a long-term healthcare condition, although we know considerably more, up to a fifth of the population saying that they've missed healthcare appointments and so on. And ultimately about 2% of all adults saying that they caught COVID. So the ultimate shift that we see, and I think it's probably the most interesting thing from my point of view, is this huge reduction in personal confidence to make decisions about one's health. And you might think, okay, this is strange. Why would this have happened? Our estimation of it is that it's to do with, I suppose, the tonality and the type of messaging that the public were hearing for the past 6 months. They were being told to stay at home, to follow 5 simple rules, and they were being addressed in a very authoritarian manner. And the state didn't take them by the hand and guide them. The state kind of ordered them. And it seems to have had quite a dispiriting impact on people generally. They have lost confidence rather than gained confidence in their own mental abilities, and it has been quite a profound setback for people. And it really does give us an important lesson in how the state should address people in times like this. And obviously, we've no back data to go on. We haven't experienced a situation like this before, so it was trial and error for the state just as much as it was for us as workers and in all our different sectors, whether it's market research or pharmacy or pharmaceutical manufacture. And so it's been an interesting period, and one that's had a big impact on people, and one obviously that we know we're not out of yet. So it behoves us all to think more about the psychological impact of the time that we're in, and I suppose that maybe should become the priority in the months ahead. So that's as much as I wanted to talk to you about.
morning, all. Thank you, Larry, for some amazing detail. And we'll reconnect on some of that. If I just do some of the introductions, so just welcome Gráinne. I know Oliver's introduced, so Gráinne Leary from Arthritis Ireland, Nicole Foster from Text 50808, and Darla O'Loughlin from the IPU. I think there's a lot for us to reflect on in what Larry has shared, and I think certainly one of the challenges we all have is working from home or working in different environments that makes even events like today more complicated to present. But more specifically, Dara, if I just open up the discussion, could you share more on the impact in pharmacies? Larry's mentioned about how there's been a changing dynamic in the background, but pharmacies very much in the front line.
That's right, John. And it's interesting that you started your remarks by talking about working from home, and the assumption is everybody's working from home, but pharmacists aren't. From the very beginning of this, pharmacy was deemed an essential service. So even the morning after the first lockdown announcement, they turned up and they opened the shop up and they were ready to welcome patients in. And the whole thing had an extraordinary impact because little was known about the illness at that time. There was a lot of nervousness and stress and anxiety amongst the public. We saw panic buying and queues of people at the door of pharmacies and surge buying, and people worrying there wouldn't be any medicines because you guys in the industry would all contract COVID and the supply chain would break down. That was an incredibly stressful time for patients and the public, but for pharmacy teams as well, because they were as nervous about the disease as everybody else was, and yet they were there doing their best for their patients and their customers. And with GP services largely physically closed, there was an extra. So what Larry has discovered in the research is something that intuitively any pharmacist could have said to you, which is there's an extreme uptick in the number of people that just needed to talk to the pharmacist. They wanted face-to-face healthcare advice, information, reassurance an awful lot of the time. Am I doing the right thing? Am I taking the right medicines? Do I need to cocoon? Will there be more medicine next week? And the pharmacies delivering to people's homes as well, who were too nervous to come out. So it's had a massive impact on pharmacy, and that continues to this day. With pharmacies are busy in the medicine side, busy on the healthcare side, very little happening on the retail side. Revenues are down and the workload is up and the stress levels are up. And we're facing into another winter that makes people very nervous because last winter was the worst on record.
And just talking about that, maybe just in a little bit more detail, I think if there is increased footfall, the dynamic of that has entirely changed then, Dara. Would that be fair to say within pharmacies?
Absolutely, John. I mean, we've got physical distancing measures in place. We've got queuing systems and one-way systems, limits on the number of people who can come into the pharmacy at any one time so that we can ensure that patients, customers and staff are all safe. And some of that was easy enough in the summer when we had good weather and people didn't mind waiting outside, but it's going to be different now. But we've also seen some regulatory changes that will help a bit. So if you're going to your pharmacy for your flu vaccination, the pharmacists now, just since this week, is allowed to do that vaccine somewhere other than within the pharmacy. So we're seeing pharmacists planning on doing it in people's cars, in the car park if the pharmacy has a car park, or maybe going to the community centre, running flu clinics in another centre. On Claire Byrne Live last night, we saw pharmacist Kate O'Connell actually give Claire through the window of her car. So it's just an illustration of the kind of changes that are being made to make it easy for people to access healthcare, given the physical limitations of the pharmacy premises.
Thank you, Dara. And just a wider reach out to those who've joined us this morning. If you have questions, please feel free to pop them to the panel. It's a very open session and welcome to you all. Just if I move to Gráinne Leary from Arthritis Ireland, and I think a lot of information in what Larry's presented about different age cohorts and conscious about the older people who seem to be most at risk when it comes to COVID-19, and clearly arthritis is most commonly found in that older cohort. How are they faring currently, Gráinne?
Well, I suppose it's been a hugely difficult time for people, for older people. They've been disproportionately affected by this. Obviously, in terms of the big figures around mortality, they are the group. I was looking up some stuff there from statistics, Central Statistics Office last night, and over 92% of people who died between March and May were over the age of 65. So we know that it has a huge impact, and that then relates to some of what Larry was talking about the fear, the anxiety, the mental health and the psychological impact of this virus. But also, day to day, older people have had their lives turned upside down. So if you like, all of their routine since March has been completely disturbed. So in terms of, obviously, in the lockdown period, people were very familiar with the term cocooning, and people over the age of 70 were asked to cocoon. And if you like, many of those people as well would have been very active members in their community. Sometimes, delivering care and support to older members of their community. And suddenly they found themselves in a situation where they had to reduce their, contact with family, their friends, all of their activities that they would take part in the community. So I suppose, yes, it's been a hugely difficult time for that age. The other group, I suppose, is the medically vulnerable, who many of whom are over 70, but then many people are not. And that's something in Arthritis Ireland we're very conscious of, because there are many thousands of people who are living with inflammatory arthritis, who tend to be younger. So they then as well became part of this cohort who sometimes needed to cocoon. So look, it's been an incredibly difficult time as well, and certainly with the numbers the way they're going at the moment, that anxiety and fear is only likely to rise in these cohorts as well.
And that was a question I was going to ask, Ronnie. Obviously, the last day or two has been pretty turbulent. How did that change the dynamic at all with the people that you're in contact with?
Certainly, people are, they're calling us more. I think it's with anything like this, when you have a long-term health condition like arthritis, and many people certainly in the older age groups will have one more long-term health conditions. So they're wondering about whether they're at risk. What does it mean in terms of the numbers rising, and what should they do now? What is the advice for this particular group? And I think the advice has been clear for the over 70s again to look at reducing social contacts. But I suppose what it does is it at a time of the year when we're already, I would say, 7 months into it, it's a difficult ask of this group again to kind of cocoon, and particularly, well, not even cocoon, but to reduce social contacts, to spend more time at home again at a time when it's difficult as well over the winter period. So certainly people are more fearful of what lies ahead.
Yeah, thank you, Grania. And Nicole, just a question, I suppose, very specifically, again, perhaps a different age cohort, clearly younger people coming through in the research from B&A that Larry shared in detail as well, and a kind of feeling about, a loss of control, and an emotional time. What does that tell us? How are the younger people feeling at the moment?
Yeah, certainly we've seen a lot of anxiety and stress from younger people on our text service 50808. Even the Leaving Cert, that caused a lot of stress and anxiety about what's coming in the future for younger people and how to cope with that. And then also the restrictions at home. So lockdown measures making everyone have to be really isolated together, and the kind of stress and difficulties that can cause for people as well, not being able to get their own space. So we've seen a lot of young people struggling with a lot of uncertainty about what's going to happen with their own futures and with their own independence. And then also that's been increased by being really locked in with other people in their homes that maybe they would have difficult relationships with and things like that, and needing to find outlets, but not being able to actually have a lot of physical space to cope with that.
Yeah, thanks, Nicole. And I think just talking about the service you offer, obviously the social media is even more prevalent and in more homes, perhaps than outdoors these days. How is the importance of that direct communication via text, for example? How important is that to the younger generations?
It's been the feedback that we've gotten from our texters is that it's been very important to them, especially as things haven't been open to them like other services where they maybe would be walking in typically. And so being able to text in any space and have it continue to be private and anonymous has been really helpful for them to be able to kind of get off their chest what they're going through without having to feel like they're having to talk and be overheard on the phone and things like that. So it's certainly been an outlet that has been really utilized by young people and people of all different ages, really, we've seen across the board. But definitely for young people, it's been a great outlet for them to be able to express what they're going through without having to have the consequence of being overheard.
Okay, so now an element of privacy that obviously is important. Thank you, Nicole. Just Dara, I think to go back to pharmacies, and very much the front line. I think we hear about increased footfall, lots of challenges, but we also hear of economic challenges, across pharmacies. How do you reconcile the difference between an increase in perhaps people presenting themselves in pharmacy versus financial challenges?
It's very, very difficult to square that, John, and a lot of pharmacies are in real difficulty. The ones that depended on retail footfall and retail sales to help cover the costs of running the business. It's long been accepted that the medicine dispensing and the HSE funded part of the business is not that profitable. It's supported by retail footfall and commercial activity that has evaporated. And so I've heard from pharmacists whose pharmacies are located in areas, commercial areas, high footfall, high foot traffic, where their customer base has physically disappeared. But they're still really, really busy on the phone. People are calling up, looking to see if they can get their prescription posted out, or looking for advice and information, asking questions, but there's no transaction very often. I think that comes back to Larry's research about ordinary people's uncertainty about taking control of their own health and their need for reassurance and need for advice, where previously they mightn't have sought that. So there's lots more conversations and time being spent in pharmacy with people, and very often there's no transaction. So you can be incredibly busy, but not doing business.
And Dara, with the pending level 3 that we've landed on now, feeling that may escalate, is there any thoughts on does that further extended, or what's the impact on pharmacies if we're possible to think into the future?
Pharmacies are very nervous. Some of them are wondering how they're going to survive a long period under level 3 or any higher level. When you look around the city centre, Dublin, Cork, Galway, Limerick, any of the big urban centres, you see so few people walking around. That means that there's nobody in any shop, including a pharmacy, spending money. Pharmacies located in residential areas are really busy and are probably doing quite a bit better because they're close to where their patients and customers are right now. But they're just exhausted at the end of every day, because you go into pharmacy to help people, to make a difference in your community, and they're doing that. But they're suffering from stress and anxiety themselves. The most worrying part was when early on during this pandemic, we got a phone call in the IPU from one of the major mental health organizations running a helpline to say they'd seen a big uptick in the number of pharmacists and pharmacy team members telephoning them in mental health distress. Now we've managed to put some mental health supports in place since then, but it's just an indication of the level of stress that's out there, the economic stress, along with the workload, along with the anxiety around the disease. And am I going to bring this home to my family, to my parents, to my kids? It's not an easy time to be working in healthcare, and we mustn't forget that pharmacists are frontline healthcare.
It feels like very much an amplified impact on pharmacists. I think that talks, Larry, to one of the key points you were touching on, which is the impact of COVID on our mental health. Just one of the attendees has a good question, which is really perhaps more broadly. But you've been tracking public sentiment. You mentioned the RTE program that was on last Thursday. What are the top 3 trends that you would see, as we deal with the pandemic, if we look at it in a wider perspective?
Gosh, I suppose a big one that has been consistent right through the pandemic, but I suppose was alleviated to some extent by the introduction of the furlough schemes and the wage support schemes, has been worry about money, and that's caused huge angst and anxiety for people. But and then obviously, calling those schemes temporary wage support schemes and so on, that causes uncertainty for people because they're not sure whether their employer will take them back or not, and will the income support run out. That's a huge issue. And then, as Nicole was saying, for so many generations being stuck together under the one roof and spending enforced periods of time with family members, that can be very unnerving and unsettling. And then I suppose the displacement of routines has such a big impact both on young people and on old people. As we saw in the RTE data last week, up to 55% of middle class Dubliners are now working from home every day. And that, that's okay for a bit, but if you then hear this is going to go on for 6 months or a year, and so many large employers are announcing the extension of these work from home schemes, but then equally the stress that many working class employees face, that they have to go and work in shops and so on every day, and run the risk of coming home with the virus and spreading it to elderly family members and friends. And then I suppose otherwise it's just that the sense of dislocation from parents and grandparents get so many experiences that they can't go and visit them, and older people feeling they can't go and see their grandkids and so on, with no sense of an end to that. To the extent that even when we talk to a lot of older people in research, they're kind of saying, I'm prepared to now take the risk because I would rather spend time with my grandkids than live in isolation and be unhappy. So there's a raft of different emotions going along for people, and I suppose they all create uncertainty, and as we know, uncertainty is the enemy of confidence, and the big underminer of economies and everything else. So we must restore certainty. That's the critical thing, and to have government officials making announcements off their own bat, it creates a terribly uncertain environment, and then to have cabinet ministers in the Taoiseach challenging them publicly doesn't really reassure people about there being a strong plan underlying what's happening.
Yeah, thank you, Larry. And I think when you talk about that kind of, impact, Gráinne, does it feel like there's a disproportionate effect, perhaps, on those who are more elderly? How does it feel to them, this current extended area of unknownness?
Yeah, I mean, I think because people that are older tend to have long-term health conditions, I think it's. I think over the summer people saw maybe a change, things had opened up a little bit. It meant that there was some of the, their social contacts were back in place, and it seems now that we're moving backwards at a time of the year when it's much more difficult to do that as well. We have the longer days, the longer evenings, darker days, colder weather, Christmas is coming, times when families get together. And I think that's really difficult for people, not only over 70, but again, all of those people out there who have health conditions that require them to be really, really careful about social contact.
Very clear. And a kind of similar parallel question. I think the younger generation have kind of featured more negatively, perhaps in the media, fairly or unfairly, but it feels this has a much more heavy impact. How does it feel more recently for them, about the impacts? Do they feel their impact disproportionately equally? There's such a thing.
Sorry. Yeah, I think the impact on younger people is so diverse, like it is for everyone. And so certainly the fears that younger people have about their parents or guardians catching COVID-19 who have to go out, who are essential workers going out and working every day, that's a big fear that young people have, as well as just feeling loneliness and social isolation like all of us. But as we all know, when we're younger, feeling detached and out of the loop from our social groups can be really difficult for us to feel a sense of connection with our entire world. And so certainly disconnection, but also a lot of fear about those people that they love in their life who have to go out and work and serve others every day, and them being put at risk is something that we see a lot from young people, being worried about their loved ones getting COVID-19. So
it's tough times. I think another area that we didn't cover today, Larry, but we have a question from Sean very specifically, is about, does the survey, does BNA share any research of any idea on the prevalence of so-called COVID deniers? Obviously, we see it in the broader media, perhaps in other countries more than Ireland, but is there a prevalence in Ireland that you've picked up in any of your research?
We haven't measured COVID denial as such. We saw last week in the poll for RTE that about a third of the population say they wouldn't take a vaccine when it becomes available, but it wasn't certain as to whether they were worried about the vaccine potentially or in doubt about COVID entirely. I'd be very surprised if it was any more than about 15 to 20% at the very most in denial of COVID as a phenomenon. Though we do know that there's groups of 20-25% who have expressed doubts in relation to some vaccines on some basis, but obviously a number of the vaccination programs have been undermined by fully concerted anti-vax activity from 2015, 2016 onwards. So it would be surprising if there wasn't a sceptical bunch out there. But we haven't specifically measured it in Ireland, but I would guess, a fifth to maybe a quarter at very most who would be deniers. And certainly I walked down Grafton Street on Saturday afternoon. There was a big anti-mask protest, but big, I would have thought maybe 1,000 people, 1,500 people. And they looked fairly flat earthy to me. Not the most representative bunch of people I've seen, and not very convincing, So I think we're largely aligned with the view that the vaccine is real, and we're all anxious to see a vaccination brought in to address it.
I think I heard 75% is the level of vaccine, I believe, is ideal for herd immunity to kick in. I think when you hear a resistance to some extent to that, it sounds concerning. Possibly a link to a question again from the audience, from Sean and Dara's view specifically about the opportunity to expand services in pharmacy, conscious, vaccinated the vaccination season. Are there other things that pharmacy could offer? Conscious of the challenges already within that channel, in that business.
Yeah, well, the answer is yes. Most health services are used by older people, people with comorbidities, and so on. And those people largely have their healthcare funded by the state, and their GP visits are funded by the state. But right now, they're coming into pharmacies asking if the pharmacist can measure their blood pressure, because obviously before extending a prescription or repeating a prescription, you need to make sure that it's appropriate to do that. People can't get their GP. In Scotland, in Wales, in Northern Ireland, the governments have relaunched their minor ailment and common ailment schemes to let people with less serious illness get treatment directly from the pharmacist on their equivalent of the medical card on the NHS. Our government hasn't moved to do that yet, and that seems like a missed opportunity. So we're forcing people who don't need to see a doctor, we're forcing them to go and see a doctor, to take up a doctor's time, while at the same time claiming that we're trying to do our best to protect overwhelmed GP services. And there's an awful lot pharmacists can do, and we've talked about it so often, and we've even had previous ministers for health repeat it back to us about the great things that pharmacists could potentially do if we had a new pharmacy contract with the state and so on. But we haven't seen much sign of that innovation happening yet in Ireland. It's like we've, I think the president of the Irish Medical, or the Hospital Consultants Association, said we've implementation deficit disorder. We can recognize a good idea when we see it here, but we're just not great at putting it into practice.
Okay, so Dara, if on a question, I'll go around each of the panel. If there's one thing you could change, would that be it, or what would you change if you were the Taoiseach, the Taoiseach, if you could change the word of Minister for Health, if even wider than that, what would be the one thing you'd look to change, taking the research into account and the challenges we're currently facing?
I wouldn't reinvent anything, and I'd look across the Atlantic at what they do in Canada, where pharmacists can order lab tests, can write prescriptions, can adjust medication, can adjust therapy, and where the evidence shows that they achieve better outcomes in things like blood pressure control and diabetes control. Because, as Larry has pointed out repeatedly, people go to visit their pharmacist far more frequently than they visit their GP. So there are more opportunities to monitor long-term conditions. So if I was the Minister for Health in this country, I would just call my colleagues over in Canada and I'd say, can you send me across your rule book? Because we need to implement the same thing here so that Irish patients and the Irish public get the same access to high quality healthcare that the public has in Canada.
Very clear. So take best practices from countries such as Canada. Really clear. Nicole, if I was asked the same question, if there's one thing that we could change to make things better, what would it be that you would do?
I think just speaking for young people, I would just try to be mindful that all of those issues that kind of older people or adults are feeling, young people are feeling those as well, because there's a lot of young people with older people in their life who are really feeling the stress and anxiety of those people being at risk and themselves being at risk. And so I think just looking at the COVID-19 and how it impacts all of us together, I think that that's really important instead of looking at how we're impacted individually or in our age sections. We're all impacted.
Wise and clear. So it's everybody is in it together. Very good. And then Angronia, what would your perspective be if there's one thing that you would look to change or look to adopt?
I might just mention two quick things briefly. I mean, one of the just about I think some of the language around older people has been quite disempowering. So some of the narrative, and that's something we would hear quite a bit from people we would be in contact with in terms of, the over 70s. Some of the language was quite, I wouldn't say it was quite negative, pessimistic about this age group, that they need to be minded and cared for. Yet they are, and they do, but a lot of the narrative was focused on that in terms of this group not being empowered to take control of their own lives as well, I guess. So that aspect has been removed. I think the other thing that it would be just in relation to healthcare. Certainly we would have a strong sense from speaking to our cohorts that, there have been a lot of cancelled clinics, people not seeing their relevant healthcare professionals, consultants, etc. And there's been a lot of talk about virtual clinics, but our certainly what we hear on the ground is that that's very patchy in its implementation. And again, it's kind of to Dara's comment about we know it's a good thing. We know that virtual clinics are really important at this time, but certainly the implementation of that in at certain points has been quite, and certain institutions has been quite patchy in terms of reaching out to people, because we can't afford to push people's health down the line. We're just building up more trouble in the future.
That's clear. So I kind of feeling an overbearing negative tone towards the elderly, and some of the accesses aren't as clear, for example, into virtual clinics. Would that be to look to change?
Yeah.
Okay. Very good. Larry, I think same question for you. I think again from a wider perspective across DNA, if it was one thing that you've seen either specifically in the research you've run for IPU and IFA, or more broadly, that would be a fix that would be better for all?
I suppose two things really. One would be really just for us to focus on how we talk about COVID and how the state addresses people about it. The language, the terminology that's used, as Grania was saying, how old people are talked about. They're referring to them as cocooners and so on. So a lot of the terminology that has been used has been quite authoritarian, and we have handled the pandemic. The state has handled the pandemic in a manner that seems very old-fashioned, and it's very parent-child rather than being adult-to-adult. So the mode of address is unusual, and I think we could learn a lot from how other countries have handled it. Canada stood out as a beacon from the start in terms of how it talked about COVID, the kinds of research it did right through. It stopped using the term social distancing about a week into the pandemic and talked about physical distancing, because it found that the term social distancing caused alienation and it upset people, and it decided not to use terminology like that. So I think firstly we need to learn from the countries on how to talk about the measures being taken, and I suppose to be more consensually driven. And then apart from on the health side, I think just the need to have to draw in more perspectives into conversations around how society, healthcare, and the economy are managed. There'd be a very strong view out there now that we've been led too much by a very singular perspective of how the pandemic should be managed. And it was encouraging yesterday to hear the idea that we should balance people's health with the importance of the economy, and to see that those two things together. But I do feel that the state hasn't drawn in other perspectives into the conversation. It listens to NAPIT, and it doesn't seem to listen to anybody else. And I think that really is a change that is beholden upon them.
Okay, thank you, Larry. I think we've one question in from the audience, which is about the psychological impacts of it, and across all the population. Again, Larry talks to some of the language, perhaps, and some of the way that's been managed. If there's a vaccine, are we dealing with we've already said that there's people that won't take a vaccine, people that will be non-compliant. Do we see that? An open question across the panel. Do people see that as being a challenge out there across the areas that you're closest to? So people who won't connect with the healthcare services. Perhaps Dara, I might point it at you first.
Yeah, I think some of the impacts that we're seeing, and Darius just said it, people were instructed, they were told by NPHET and by health authorities what to do, and that's undermined confidence. And I don't want to step on Nicole's space by talking too much about young people, but I see it with my own teenage daughters that there's an anxiety there that's difficult to shake off. And if we go for a walk around town and they fancy a snack, they're nervous about going into a shop or going into a cafe to get it. And they're anxiously checking to make sure they have masks before they leave the house. And they're standing upwind of people rather than downwind. And I hope that they can get over that, because I'd hate to think that people are going to carry that level of anxiety with them through life. And then we look at our own parents. I look at mine who have comorbidities and long-term illnesses, who didn't just cocoon in their house, they barricaded themselves into their house for a long time. They thought they weren't allowed in the front driveway, so they stayed in the back garden. And there's an anxiety there now where now they think it's a big adventure to go and collect their own medicine from the pharmacy. And I hope that our world hasn't shrunk to that extent. We all remember vaguely traveling, we remember going out and living lives. And that lack of confidence could become a permanent thing. Now, if you're in the healthcare world, you might say, well, that's a great thing. People are going to depend on you more. But dependency is not a good thing. And in previous years at these events, we've talked about how patients and the public are now working in partnership with their healthcare providers and with their medical experts, and they're making decisions together. And I'd hate to see us slipping back to a space where people who are nervous and who are anxious and who are lacking confidence are coming in asking, what should I do? And then doing that thing, because nobody is the expert on anybody's healthcare anymore. It takes more than one person, and people need to participate in decisions around their own lives and proactively get out there and live their lives.
Gráinne, how does that feel to you about helping people live their lives and look at it, trying to have more liberty, I think, perhaps moving away from the idea of unrest, but take more ownership?
Yeah, I mean, in the organisation I work with, we believe so much in self-management. So the idea that people are empowered to make their healthcare decisions, and we, all of our services are sort of founded on this principle of self-management and improving people's confidence to manage their healthcare conditions, whatever that might be. And I think, from Larry's findings there, what I really focused in on there was sort of the lack of confidence, or the reduction in confidence that people now feel about making their healthcare decisions, and they're making less decisions. And, at the end of the day, 80 to 90% of our healthcare, if you have a long-term condition, is down to yourself. You will never be able to fill your days and your hours seeing healthcare professionals to help you make those decisions. You have to have those skills. You need to develop those skills to make many of those informed decisions. So I think that is kind of quite a worrying trend if that was to continue, and will have huge implications for people in our community.
Interesting. And a similar question, maybe if I turn it into a more positive perspective, if there's a concern over dissonance, how do we turn it into a more positive impact for the next generations? Is there anything we can do with the current challenges, the pandemic, to help a certain generation come out stronger from it?
Well, I think we can learn a lot from young people. Obviously, I'm a fan of young people. So, but I think, like Dara mentioned about your daughters, Dara, like even the precautions that young people are taking now, even though it might be done out of anxiety and fear right now, it's great to be able to see that young people are taking precautions and are also encouraging their relatives and the people in their life to take those precautions as well. And so I think that recognizing young people for the leaders that they are and that they can be, especially in times of stress and hardship, is a really great way to be able to bring unity to a situation that can cause a lot of disconnection, and to also let young people feel like they're contributing in a really positive and proactive way, instead of, like you mentioned, Grania, the language that can be around young people's participation being quite negative, and also kind of finger pointing towards them as kind of a negative factor in the spread of COVID-19.
Thanks, Nicole. It feels like it resonates with Larry's comments and Dara about a more positive, connected global tone that could help all kind of chart into the unknown. I think at that stage I'm really conscious of the clock. I'd like to thank all the panel for connecting and really sharing unique perspectives from the areas that you're the experts in. So a big thank you on behalf of myself for how you've answered the questions and given us some challenges to think over further based on the BNA research. So thank you. I'll pass to Oliver.
Yeah, thank you very much, thank you, Nicole, Grania, Dara, and Larry, for a very insightful and very indeed thought-provoking discussion there. All that information is very useful to us. I think, particularly at the discussion wrap-ups at the end that people had, it's a very much communications problem, and I think our industry is very conscious of its responsibilities in this regard, particularly as we face into the development of therapeutics, and indeed the developments and the work that's ongoing to seek and vaccines being delivered. That itself will be an immense challenge in terms of communications, public understanding, public acceptance, and so on and so forth. And I think there are a lot of lessons, that some of which are brought out today, that we can all take on board and think about quite a bit before we get into that space. So our digital thinking series will continue over the next number of weeks with different perspectives from our industry and our partners in our affiliates program, and with some of our with our sponsorship of Unifar. Again, to thank them, thanking our panelists, and we really look forward to having plenty more interaction and thought-provoking sessions like we've had this morning. And with that, I'll say goodbye and thank you to all those who participated. Bye now.